Hello everyone, I am Dr. Dharav. I am vascular intervention radiologist. So welcome to today's educational video about varicose vein. In today's video we are going to talk about how varicose vein develops, basic anatomy of veins, understanding of varicose vein and its implication in the symptomatology and the treatment. So let's start part 1, normal anatomy of veins of the leg. So we have two sets of vein in the leg. As you can see in the diaphragm, we have deep veins which is dark blue in color here, shown as dark blue color, and we have superficial veins, surface veins. So surface veins are present over the skin and subcutaneous tissue, and the deep veins they run along the bones, along the deeper part of the muscle. So 80% of the blood, 80 to 90% of blood from the leg goes through the deep veins, and remaining 10 to 20% of blood will flow through the superficial veins. Now as we stand, because of gravity, blood can pull down towards the leg. So in order to prevent that, nature has given valves in both deep and superficial veins. So there are multiple valves you can see here are there to prevent backflow of blood down. Also normally surface vein will drain into the deep veins via multiple connections. So there are several connections in the leg, several connections in the thigh area, and there is one big connection in the groin area. So this is a normal anatomy of vein. That's how blood travels from down to up against the gravity, and because of valve, it will prevent backflow of the blood. Now let's see how varicose vein develops. Varicose veins are basically a disease of valves. As we have seen in the first part, valves are very important to prevent backflow of the blood. Now because of certain risk factors, this valve can become faulty. Now what are those risk factors? Old age, female gender, then occupation will require prolonged standing like the teacher, traffic police, salesman, obesity, sedentary lifestyle, genetic factor, family history, valve can become faulty because of the genetic factors, hereditary factors. Because of all those reasons, valve can become faulty. Now see in this diagram, this is the main valve at the groin area. If this becomes faulty, you can understand instead of blood going up, it can go down, and this vein can become dilated, it can become tortuous, as you can see here. If this connection become weakens in the leg area, as you can see in the diagram, blood from the deep veins can come into the superficial vein and it can develop tortuosity, varicosity. So that's how varicose vein develops. These veins are not useful in the body, that you should remember, because it is acting as a channel for blood to go down. Instead of helping blood to go up, it is acting as a pathway for blood to go down. So that's how a varicose vein develops. Now let's see how symptoms develop because of this varicose vein problem. So as you can see it, because of this varicosity, blood is going down instead of going up, it is accumulating in the leg area. So because of this thing, you may develop visible veins. Normally veins are not very prominent or visible, but because of this tortuous dilated vein, you can clearly see veins are visible over the leg area or the thigh area. It becomes cosmetic concern. Also it becomes circulation problem. Now the blood is not able to go back, so blood is accumulating there, so the muscle may not able to function very well, the skin subcutaneous tissue may not able to function very well. It can cause pain, it can cause inflammation, it can cause muscle cramp, and all those symptoms tend to get worse when you do prolonged work, when you stand for long time, especially in the evening time. All the symptoms tend to get more exaggerated in the evening time, and also if it is not treated, the blood can accumulate for a long time, and then eventually hemoglobin can burst. It will produce a pigment called as hemosiderin, which is brownish blackish in color. So it can cause blackish discoloration, brownish discoloration around ankle region. It can cause long inflammation, so eventually fibrosis will happen, and skin ulceration, later on skin ulceration can happen. So all the symptoms are because of the circulation problem. Now based on this understanding, we can do the treatment. Now you should understand this vein is not useful in the body. It is not helping in blood circulation. So if in order to treat the varicose vein, we need to get rid of this vein and along this varicose vein. Also, this perforator and these veins are not useful, and your blood is not going back through this vein. So we need to get rid of these veins. So earlier years, surgery was the only option. We have to take out this vein surgically out of the body. But nowadays we can internally block without doing open surgery. We can block this vein internally, either by laser, RF ablation, microwave ablation, or latest is a glue technique. So in that technique, we put a small tube inside this vein internally and block this vein by using glue. And for this leg varicosity, we can do sclerotherapy. Sclerotherapy is nothing but a small injection. We use a special liquid sclerosing agent to block this abnormal vein. So it's a combination of both glue and the sclerotherapy. So that's how we can treat the varicose veins.